Hi everyone, Amber Canoy here for Everyday Kentucky, and we're over at UK Healthcare having a conversation with Dr. Loebe. First of all, thank you for being here. And you are the surgical director with the lung transplant program. I want to know a little bit about that, how many transplants you do in a year, because ultimately we're wanting people to realize the need and hopefully give blood to help you all.
Yeah, the University of Kentucky does a little bit over 150 transplants in total this year, and we've done 4 lung transplants, we've done 12 heart transplants so far in the first half of this year. So the lung transplant program we just restarted, and obviously there's a huge need in the community to provide these kind of services because there are hardly any other places around to provide those advanced therapies.
With those, how often are transfusions necessary?
Well, I would say that about half of our patients are going home without a blood transfusion. Okay. But you have to remember that many of these patients have a long history of disease, have had previous surgeries, have scar tissue, so they are supported with mechanical support devices, so that there's a lot of adhesions, scars, and they have a high tendency to bleed. Also, these patients have been on blood thinners for heart disease, aspirin, and other things. So, and they come in for the transplant, which happens in the middle of the night, so we don't have time to correct these kind of things beforehand, like in an elective surgery. So that's why we definitely have to have available a good amount of blood transfusions.
Yeah, and I know 40%, by what I understand, of all the blood that's taken by the Kentucky Blood Center is coming right here because of your all's need. From your perspective, what would you tell people is why it's so critical to donate?
It is very important to have blood transfusions available so that we can do these advanced therapies, and we can do them at any given time when patients need them, when organs become available or when patients suffer trauma. And obviously, as this center provides extremely advanced therapies, and we can only do that with blood transfusions available.
Yeah, and you never know who it's going to be. It could be you, it could be a family member, so everybody should donate.
That is correct.